Okay, welcome again, Vanessa.
Okay.
We're ready to
Good
go.
morning. Good morning, counselors. I'm Vanessa Gaston. I'm the Director for Clark County Community Services. I have been in this position since October of 2007. You have the PowerPoint for our department. You have an org chart. You also have our most recent strategic plan. So I'm just going to kind of hit some highlights and talk about some of the priorities we're focusing on right now during the legislative session. So one is community services. We focus on funding certain programs that help low-income, disabled, and other vulnerable marginalized populations throughout Clark County. So we don't serve everybody. I currently have 34 staff and 4 of them are managers. Our annual budget for 2024 is $73.4 million. And that comes from 38 different funding sources, federal, state, and local government. About 1.2 million of that is county general fund. So we are not a big county general fund department. And we use the county general fund to fund things that these other funding sources cannot fund. And so right now, about more than half of that is the county council made a decision years ago to spend approximately $170,000 towards the veterans. So the Veterans Resource Committee allocates that funding to the Veterans Assistance Center. They have, since I've been here, they have allocated about $249,000 towards homeless programs and low income assistance programs because of the shortage in the homeless funds. And then just recently, last year, I put about $200,000 to help with emergency shelter during severe weather. The other funding we use for admin where we can't cover our admin. So right now we manage the contract for the opioid abatement lawsuit, and my staff charge their time to the general fund to be able to monitor that contract. So, but whenever we are asked to cut for general fund, we do make our cuts, and we have done it every time we've asked. And so we just prioritize how those dollars are spent. We also have 4 units. My department has 4 main units. We have our business unit that manages the budget for us, which is the finance and contracts. We have developmental disabilities. We have a behavioral health and youth. And then we have our community housing and development, which is our CHAD unit. We have over 126 active contracts with various providers throughout the county. That number is going to go up because we just now added on the new mental health sales tax contracts from the 2024 RFP that was approved during the annual budget. Again, as I mentioned before, we have the funding that is made up of from our department. We have about 16% is federal funding, and we have 48% state, 31% local, which is mostly all of this is restricted funding. So that's mostly our document recording fees and other kinds of fees that come through. And we basically this is given to us through federal, state grants and contracts. And these are restricted dollars. So we don't have a lot of flexibility on how we spend these dollars. almost 86% of these dollars are contracted out to the various providers in our community, with the exception of our youth programs. We have 3 youth programs that operate out of the youth house. Those are staff who do those directly with kids from middle school and high school throughout Clark County. We have 7 advisory boards that we staff that provide input and guidance into how we deliver our programs. And those advisory boards consist of community members, elected and public officials, and people with lived expertise. We are a heavily audited department from every year. State Auditor's Office audits our programs. Also, all of our federal agencies and state agencies audit us on a regular basis. We are required by our funding to do a community needs assessment every 3 years. We also are required to have an updated strategic plan. And so we do that on a timely basis. We get community input. We hire some consultants to help us get some community input from providers, community members, clients who use our services to include in both those documents. And those are submitted to our funders. My staff and I also participate in many local, regional, and statewide boards and committees and work groups to basically advocate for the needs of Clark County. And a lot of it has to do with either program changes or funding changes that come our way. This year, we have quite a bit going on in the legislative session for my programs. We always have to pay attention to the legislation because so much of dollars come from the state. But there are four main areas that are causing us to put a lot of attention in. One of them is the county is responsible for most of the counties are responsible for the homeless action plan, with the exception of the city of Spokane also does their own homeless action plan, with the county covering the unincorporated area. But the counties are the first and foremost that the state charges to be responsible for that. Any city with a larger population has the right to do their own homeless action plan, but the counties are the one that the states have the main contracts with. There is a shortfall in homeless funding across the state. And so our advocates, they have for almost every year have been advocating for trying to increase state funding to meet this shortfall. Right now, document recording fees is the biggest funder in that, followed by state general fund and some federal dollars. The shortfall the next annual for the next year is going to be about $126.5 million. The state is on a biennium budget. The county's portion of that we collect locally is about $50 million. The portion for Clark County is about $3.5 million. If you want to know, well, what are we spending $3.5 million on? Our two largest shelters that we fund, Bertha 1 and Bertha 2, is pretty much approximate what we spend on those two shelters. That's 94 shelter beds. There is a document that the Association of County Human Services is drafting, asking WASAC to sign. I'm going to send that to Jordan and Kathleen because it would be nice if Clark County would also sign on to a similar letter and submit that to the legislature to continue to have them backfill this funding. Otherwise, we're looking at cuts to services. And our homeless action plan funds a variety of services from outreach to shelters, to the coordinated entry, to planning, to permanent supportive housing, and to rental assistance for people that are unhoused. The next bill I understand you already had some presentations about this yesterday and you're ready to draft a letter, but it's House Bill 1158 and Senate Bill 5428. It's around the community inclusion funding that comes to counties for us to operate for people with intellectual disabilities. And so just let you know that that is a big one. It's been happening for a couple sessions now, but that would be a big loss of funding to counties if this bill actually is implemented. The next one we are trying to evaluate because we're not real sure what the impact is, but it's House Bill 1397. It calls for veterans, behavioral health, and developmental disabilities property taxes that are levied against county general fund to actually be changed to be part of the state general fund. So again, we don't have a lot of information. We're trying to understand what this bill is meant to do and if counties will have first right of refusal to get these funds back. Because if the state takes these funds and decides to use them different ways, some of our programs, especially the veterans, will be totally eliminated because we rely 100% on veterans assistance funds that we collect through property tax goes through Veterans the Resource Committee to allocate out for veteran services for indigent veterans. We also, yesterday was a busy day for a lot of human services and other organizations. The President Executive Order OMB memo that froze all federal grants and assistance until at least February 10th. That applies to all our federal dollars in our department. Now, we were fortunate enough to draw down some HUD dollars before they froze out organizations from their payment systems. And each of our grants, we keep at least 3 to 4 months reserved just for these purposes, to pay for staff salaries as well as to keep programs and paying providers going until we know if they're going to continue with the funding, if they reduce the funding, or they eliminate the funding. It gives us time to look at some transition and some priorities. So that is just a high-level overview of community services. If anybody, we do operate, someone asked the question about the opioid accounts. So public health does take the lead around opioids, but we do operate the contract for the funding for the settlement, for the opioid settlement. And that is a contract through Carillon to do the administrative review and all the public dashboards and all of the other information that's required for that settlement. So we will work in partnership with public health. Dr. Melnick sits on that opioid abatement council along with 2 other counselors. So counselors, that's all I had today for you to present to you. If there's any questions for me.
Great. Thank you, Vanessa. That's quite a bit. And do keep us informed of the legislative issues that come forward. I didn't get the number, maybe Jordan did, on the veterans bill. He's got
Right
it.
now
So
it's
he'll,
House Bill 1397, and it applies to all the millages for, that applies to. So it's veterans, behavioral health, and developmental disability.
great. And related to the recording fees, I know ECHO encouraged all of the jurisdictions that participate in ECHO to write letters in support of maintaining that, and we'll do that again. Any questions by council?
I don't have a question. I do have a comment. Thank you, Ms. Gaston. It sounds like you and your team do incredible work for the community. I appreciate that. But I would also appreciate a presentation because I'd like to be able to reference some of the information that you talked about. You went through it really quickly. I was having a hard time writing down. And so I can't have specific questions to ask if I don't have that information in front of me.
Yes, so I did direct staff they don't have to do the presentation. It is included in your binder information and the thumb drive that was provided to council.
About a month ago, right? The binder that was provided about a month ago? Is that the one you're referring to?
Yes,
Okay.
all the information that you're receiving in department updates have been provided to you in the binder, and I included a thumb drive for the electronic version as well.
Okay, I think, and I understand that, but I think it would be very helpful to have that information directly in front of us as well. Thank you.
Sure.
Yes, go ahead.
Yeah, thank you as well. I'd love to have just more information so I can share with the public about where the beds are that we're providing and the current service levels that we're providing in the unincorporated areas so that it will help us direct and prioritize actions in the future. So I would love to get just kind of a summary of that kind of stuff as well.
Is that questions around the homeless action plan, or is that questions around the entire department? I just want a clarification.
Or is it just related to the shelters?
Mostly I'd like to know about the shelters,
Okay.
but I am curious about everything.
I again would encourage you to look at the information in your
I did
binder.
look at that,
Because
yeah.
I'll tell you, Vanessa's group provided the most detailed information than all the departments and offices. It's a lot of information, but that was provided to be helpful. And I actually would encourage council to in future, as we're talking about that, bring your binder with you because she did reference a lot of that, but I will. And then I know, Vanessa, some of that information is on our website as well, on her website. So
Sure.
Yes, go ahead.
I'm just trying to get a sense of what our gaps are and needs are in the county for the unincorporated areas and the people that need shelter. So just trying to get a sense of what we're already providing and what we actually need to provide.
Chair,
Yeah.
I have a comment.
Thank you. Go ahead, Counselor.
I just want to say to the new counselors, you can meet with the directors at any time. I know that we have from time to time just to get like a lot more information, set up meetings with them, which is very, very helpful when you're trying to wrap your mind around all of this and just figure out, what's happening. So I'm sure Vanessa and Michael could probably set up a meeting with both of you.
And I would say work through the county manager on that.
And they're more than happy to do that. And I know we had this discussion, council, when we started the retreat discussions of the importance of the entire council hearing and getting the same information based on for policy directions. So that's why it's a little different this time than when the last two counselors started, because we didn't provide the binders ahead of time. We did the one-on-ones, but I know Vanessa and any director is more than happy to have a discussion, but that's the intent of these discussions, is to look at the information in the binder, have the department provide that information, ask any questions, get some clarifications, and to set that groundwork. So
The binders are fabulous. I really appreciate.
yeah, and I'm not
I
trying.
appreciate everybody's work in putting those together.
Yeah.
And I think it's a good reminder to look at our binders before we come into these presentations. So thank you. Any other questions or comments?
Sure.
Yes, go ahead.
Yes, so thank you for, I would like to understand a little bit more about the bill that you had mentioned. Thank you for bringing that to our attention. And, this kind of brings something up. So we have Jordan now, who's our policy analyst. So and not just your department, all of the departments, I'm hoping that anything that any of the departments are looking at in terms of state, potential state law being passed or being advocated for somebody to move forward with it. I would appreciate all of that information coming to Jordan so that the council can be aware of the situation and weigh in if we should need to. But really more just for information purposes so that we can understand kind of the dynamics of things moving forward. You did a great job summarizing some of those things this morning. I appreciate it.
Absolutely. We do share with Jordan. Once we know more information, we definitely, and if we need something from county council, we work through Jordan to get a letter of support or something.
So actually, just one question really quick. I apologize. So I'm wondering, so the funding that we, or the letter that we approved for the developmental disabilities, is that one of the 3 funds that we're talking about that are like a sub levy where there's developmental disabilities? That's different?
Yes, it's dollars that the state gets from general fund and Medicaid.
Okay.
And you have some families who are requesting that be taken back from counties and state actually give it down directly to providers.
Okay, great. But then the veterans funding that you were talking about, was that the part
That's
of the
part of the
sub-levy?
millage from the property tax levied
Okay.
against the general fund. Yes.
Okay, yeah, I definitely would request some more information on that. I think that's important. Thank you very much.
And just to follow up on legislative stuff, the council meets every Monday morning at 10 o'clock with our lobbyists. Things will be fast and furious. So if there's any information that you have, we direct our lobbyist on Monday morning. So that's a framework to think about. Any other questions or comments? Great. Thank you very much, Vanessa.
Thank you.
Okay. I think that wraps up our work session. So we will adjourn for now without objection and see you later at 1 o'clock for council time.